transformation. Okay, transformation, phase one, think of it like you're running a kitchen, you have all these ingredients, that's your toxins, and you first have to chop them up. That's phase one. During this phase, the body picks up these dangerous molecules and starts transforming it into hopefully less harmful products that is starting the process of getting rid of them. So we're talking about alcohol, caffeine, medications, pollutions, food additives, they get chopped up. Now, if we're going to keep this analogy of the kitchen, the liver is that main chef in the kitchen, and it uses knives to slice up these toxins. These knives are called enzymes. And I just want to bring our attention, there's so many enzymes, but to one enzyme called cytochrome P450. It's a super common, it's used a lot in chopping up these toxins. And the reason I bring that up is because there are a lot of things that we can do that will interfere with this enzyme, with this knife, with the cytochrome P450. For example, you might have heard, don't take grapefruit juice with certain medications. And the reason is because it slows down this enzyme. It slows down this knife, which means the medication will be slow to be processed. So already technical, and we're already in stage one. Like, you already should start appreciating that detox is way more than just drinking water. We're only in phase one. So what's next? So we're chopping up these ingredients. But chopping can be a little messy, right? And sometimes it can make things more reactive, more dangerous. Like, think of chopping an onion can make your eyes water, like it's reacting. So when you start to chop up these chemicals, they actually start releasing charged particles called free radicals. And if free radicals are not neutralized, they can lead to a kitchen disaster, or in our case, inflammation and some serious things. So we can't just leave them chopped up. We have to get them into phase two of the detoxification, which is the conjugation. Because when they're chopped up, they're like those raw onions and they're pretty dangerous. Phase two, conjugation. So phase two is we take these chopped ingredients, these toxins, and we add a little handle to them, right? We have to put making it a packet that can then be transferred out through our water system. The conjugation is like adding a handle to these packets. And there's different kind of handles. Okay, so there's 9 different pathways here. Each one has a really long sounding name. I'm going to go through some of them just so you can begin to understand the complexity of the word detox. So sulfation basically means it takes these toxins, adds a sulfur tag to it, and sulfation breaks down hormones, thyroid hormones, neurotransmitters like your epinephrine, your norepinephrine, BPA from plastics gets done with sulfation, triclosan from antibacterial soaps gets there, estrogens gets broken down in this pathway. The next pathway is glucuronidation. I'm trying to keep the kitchen metaphor going. So it's like wrapping up the leftovers in cling film so that they won't spill. And this pathway is in charge of sex hormones, your testosterone, your estrogen, DHEA, more thyroid hormones. It's in charge of some mold. It's in charge of some medications. Next pathway is glutathione conjugation. This one is all about protection. It grabs things that can hurt our cells, like heavy metals. It tries to bubble wrap it as it packages it out. So glutathione conjugation is in charge of pesticides, herbicides, heavy metals, molds, and other medications, also alcohol. We have amino acid conjugation. That is when you take an amino acid, and that's the handle that's being put on to neutralize. So that's for aspirin, food dyes, nail polish, stain removers, and we're exposed to all that. We have to get it out somehow. Amino acid conjugation does that. Methylation, you might have heard that. Methylation takes like the chemical leftovers, like hormones and heavy metals, and seals them away in a way that they don't react. So again, methylation helps with excess estrogen, with certain neurotransmitters, with the phenols found in Botox, with vaccine preservatives. Those have to get detoxified. It also detoxifies certain chemicals that are known to cause cancer, like things in cigarette smoke and dyes and perfumes. Moving on to another Asian, acetylation. Acetylation, again, it's trying to get these leftovers, these broken up toxins, and take them out. Acetylation works on caffeine, tobacco, histamine, serotonin, and other carcinogenic things that cause cancer. I know it's a lot of words, and I know it's a long list, but I want to show you how phase 2 has all these different pathways that take these toxins and help get them out. Now, for phase 2 to really happen, you need specific nutrients in your food. But missing these nutrients actually affects the detoxification process, and toxins can build up in your body. What I really want you to get is how complicated the word detoxification is, okay? Like, what is that? People just throw it around. They have no idea how complicated it is. Let's move on to phase 3, elimination, getting it out of the body. So this is your body's garbage disposal system, right? Its main job is to escort the packets that we made in phase 1 and phase 2 and get it out of the body. This is the exit strategy, whether it's stool formation or urine formation or sweat formation. Sometimes we breathe it out. These are all the ways to get out what we processed in phase 1 or phase 2.